Please excuse the bright sun shining in my face. Yes, I cannot see the screen at all, but I'm going to record this anyway. Speaking of vitamin D, if you can get your time outside and it's nice where you are, please go outside. It is important. It does not work for everyone though, because genetically and metabolically, there can be some things going on with you that make it so that your body doesn't convert vitamin D from the sun. Mine certainly does not, and it is a genetic factor. And there are plenty of people who this happens to, so make sure that you are getting your vitamin D checked regularly. But the endocrinologist said 46 is good. So why do I feel like crap? What else does that say? Told me I have anxiety and probably ADHD and you should see a psychiatrist. Such a frustrating response from somebody who's supposed to know about hormones. But actually earlier this year, the American Academy of Endocrinology released a statement saying that we should no longer test for vitamin D because we don't know how to tell people to fix it and we don't know actually what to prescribe. That's awesome. I don't know what to do, so let's just stop testing it, even though we know it could be a problem. Anxiety, depression, ADD, ADHD can also have factors like MTHFR, MTRR, MTR, COMT, and then there's 2 other genetics that play a role in that, including whether or not your body can produce and utilize the right amount of dopamine in the system. And that is all genetic, but those are all also what we call actionable factors that you can manipulate through your environment and what you give it and what you put it into and take it out of. Most of my clients feel best when their vitamin D is around 85. And you're going to see a ton of things on here that say, stop taking vitamin D with K2, you don't need it. It's not actually true. You don't need K2 to absorb the vitamin D. That part is true, but you do need K2 to shuttle calcium out of the bloodstream and into the tissues that need the calcium to function. So if you're looking at, should I be taking something different than just vitamin D and should I switch to cod liver oil? Well, according to Dr. Harris, who studies all things that have to do with fish oils, he says that 82% of those supplements on the market are tainted or rancid. So why would you use them? And while vitamin A is a cofactor for utilization of vitamin D, there are other things you need to, including magnesium, zinc, copper, and a few other things that can help you with vitamin D absorption. The other thing I would ask your provider if they're giving you 50,000 units a week is, the form you're giving me, is that D2 that my body then has to work very hard to convert to D3, or is it D3? Because just like taking methylfolate as opposed to folic acid, you further break down the steps and make it easier on your body to utilize what you're giving it if you give it D3 versus D2. There's a ton of stuff that goes into vitamin absorption, cofactors, and utilization that I think most people don't understand in the slightest, but dismissing K2 as necessary when somebody's upping their intake of vitamin D is also neglectful. Dismissing somebody as just having ADD and ADHD when their vitamin D is only at 46 and you haven't evaluated other genetics surrounding other things related to things, because COMT is related to estrogen, believe it or not, when you're an endocrinologist, also seems a bit neglectful. You can say, I don't understand this and I want to find a colleague who knows about this better and refer them on, but you can't say it just doesn't matter and see a psychiatrist, because too many women get put on antidepressants and SSRIs and their problem isn't even serotonin, it's dopamine. If you're looking to talk with somebody and get an evaluation of what's going on in your blood work, a full consultation, there's a link that says learn more. You can click on that. Tell me what you need. I'll get back to you.